Well, I'm here today with Dr. Rob Travieso, who's a surgeon within the Department of Surgery, and he's helping to lead a groundbreaking new program here at Keck Medicine of USC, and that's the Gender-Affirming Care Program. It's really about providing quality health care to those in our community that are transgender, non-binary, or gender diverse in a safe and welcoming environment. And Rob, can you start off and first welcome and then tell us a little bit about the program?
Well, I'm very excited to be here. This program has been years in the making, despite my joining USC just recently. And the goal of the program is really exactly what you said, which is to provide comprehensive health care to transgender, non-binary, and gender diverse individuals who as a population traditionally have been somewhat left out of our healthcare planning. So it's very exciting to be here at USC as this program is getting started, and again, really trying to provide comprehensive care that includes both primary care, surgical care, and everything else in between.
You know, the program fills a void, as you've mentioned, with so many people in our community and certainly in the Los Angeles area. Tell me about how the needs of the community helped kind of shape the program that you're leading.
It was very important to me, and it's been very important to the team to involve the community in the planning of the program from the start. What does this mean? It means that Keck Medicine, as you know, has partnered with the Trans-Latino Coalition and actually formed a formal bond with them in terms of a memorandum of understanding, and they are one of the largest, if not the largest, trans-led organization in Los Angeles. We have had a number of focus groups with members of that organization in order to understand really what is missing in healthcare for this community here in Los Angeles and what we can do differently, what we can bring to the table. And we're also, as part of our planning of this program from the start, including an advisory board from the community to make sure that as we move and as we grow, we can be malleable and make a program that really reflects the needs that the community needs to have filled.
Of course, serving the transgender and non-binary people goes even further than offering gender-affirming care. Can you talk about what is done to kind of meet their general healthcare needs?
Yes, of course. I talk about this all the time. You know, obviously I specialize in gender-affirming surgeries, but transgender and non-binary people are just that, they're people, right?
Yep.
So like the rest of us, we all have complex needs that go beyond these specific procedures or these specific hormones. We're all going to have to access cancer care and general well-being care and everything else. So our goal as a program is not only to provide specifically gender-affirming procedures and services, but also to make sure that when this community comes to see us at Keck, they feel welcome in every facet of healthcare.
I know you're relatively new here, but you're also aware of some of the prerequisite work that was done by Lindsay Lawrence in terms of preparing our community for this population, which is important, right?
Yes, like I have said time and again, it takes a village, and it was one of the things that drove me to USC is you have had that village well before the time that I got here. Like you said, Lindsay and her team have been doing, I believe it's over 600 hours of training for our staff, everybody really within Keck Medicine, to make sure that our patients, when they're coming in, they're actually getting affirming care from every single person that interacts with them. And that is tremendous, and it's ongoing, it has to be.
Rob, as an academic medical center, right, we're into training the future generation of healthcare providers, and how does this program fit into that mission?
I mean, it fits perfectly. I think it's been, obviously it's been at the core of what I want to do and what everybody else in plastic surgery wants to do, but also the institution as a whole, and it's which is exactly that, is not only are we trying to provide care for our community and the transgender community today, but the transgender and non-binary community of the future. And what does that mean? It goes beyond just involving the community. It means training future providers so that access to care gets better and better. My dream is that this is not a service that people have to travel far away from home to receive, but that it's available to them as part of routine care in every place. And how do we do that? We do that by training the next generation of providers, the next generation of doctors. And so that is definitely part of what we want to do as the program grows.
I mean, what got you into it? What drove you, in terms of this subspecialty in your profession?
Plastic surgery is a beautiful field in that it gives you a lot of flexibility, right? And we operate in all parts of the body. But I wanted what I did to have meaning. And you know, being part of the LGBTQ plus community myself, this is how I could marry my profession and my personal story, and in a way that I could actually give back and do something for the community with my hands. And so that's very meaningful to me, and it's very meaningful to do it in a place where everybody else wants to be part of it, where we really want to build something comprehensive, and where there is that enthusiasm and that earnest desire to make a difference, and that's Keck Medicine.
It's wonderful to have you at Keck Medicine of USC. I look forward to working with you on this program as it continues to grow. Thank you for joining me in the conversation.
Thank you, and thank you honestly to the enterprise for really investing so much in making this program a success. I pinch myself every day that I get to be here. It takes a village, it really does. And as long as I've wanted to do this, and as much as I've wanted to do this, I could never do it alone. And so to have not just the individuals around me that want to be part of it, but the institution as a whole, it means the world, and it makes a huge difference.
Fantastic.
Thank you.